Hello, I'm Dr. Huffman from Florida Injury Medical Centers. I'm an osteopathic physician, board certified in family medicine, but I've spent most of the last 33 years working in injury care centers. In some of those centers we had chiropractic physicians, osteopathic physicians, interventional doctors that did nerve blocks and epidurals, and neurosurgeons. I've been in this field for a long time. I know how to build an integrative chiromed treatment program. I know, more importantly, how to market those programs to local MDs, urgent care centers, and attorneys. In the past, it was difficult for small chiropractic practices to integrate medical programs. The cost of hiring a doctor, the additional space in your office, the conflicts with scheduling and personality, it all became too much. So most smaller chiropractic groups simply didn't integrate the services for injury care. They'd send out their EMCs, they'd send out medications, they'd send out reports to be signed off for family medical leave or to ask for durable medical equipment. Often when you send somebody out, you never get them back. So keep your patients in your office where they belong. We help you do that with the telemedicine tool we have today. So your injured patients never have to leave your office. They get their EMCs done in your office. They get medications done in your office. They can have medical reports issued that order durable medical equipment, support and recommend chiropractic treatments, family medical leaves, all those things that you typically would send them out for. No longer do you need to do that. With telemedicine, it's convenient because you're not using more staffing. There's nothing your staff does other than tell the patients to click on this link on an iPad or a cell phone and see Dr. Huffman about their issue. There's no additional space. There's no cost to you. You're not paying me directly. I bill the insurance company for an office visit. If we collect, that's great. If we don't, we eat it. You don't get billed, patient doesn't get billed. So it's a fantastic tool. It's free. There's nothing to buy. There's nothing to download. There's no commitment long term. You use me a day, a year, or a day a week. Whatever you need, we're here to provide that. So it's a very effective tool. Now once you have me on staff, you have access to a medical doctor 24/7. So you can tell the community that I have a medical doctor here. So tell the attorneys, tell the medical doctors and others that you don't need the patients to go to an emergency room following their accident. You have a medical doctor that can prescribe medications if necessary, issue an EMC on the spot, and diagnose their conditions. So let's keep them out of the ER where they're spending thousands of dollars on useless CAT scans. Let's keep them in your practice where they belong. That's my goal. When your patients leave your office, they're seeing doctors, in some cases, discouraging chiropractic care. I do not discourage chiropractic care. I encourage chiropractic care. I understand as an osteopathic physician what you're doing and how that benefits your patients. What I'm saying is I can bring to you another tool that you have. If you need those tools, such as EMCs, medications, medical reports. And more importantly, I bring a tool that allows you to grow your practice. Grow your injury practice with new referrals from attorneys. I work with hundreds of them in the state of Florida. Primary care physicians. I work with hundreds of them in the state of Florida. And patient direct. If you market to patients that you have this comprehensive injury center, they will come. My former employer has 30 of these centers in Florida now. So I know how to create them. I've done this for 30 years. I can create it for you. No cost, nothing out of your pocket. Give me a call at 866-402-4250. That's my personal cell phone, and we can talk about what it takes to get you up and moving. You can look at my website, Florida Injury Centers, and see some of the chiropractic partners I have on the injury side of the business. So if you can give me just a couple of minutes, I'll keep it short. We can talk about what you may or may not like about this and how I might be able to massage it to work better for you. If you'd like your staff engaged, that's a great idea. We'll set up a Zoom meeting and have them chat. I'll send in some pizza for lunch and we'll chat with you and your staff and try to figure out how this might work. We want the staff to know that this isn't something that's going to cause additional stress on them, where they've got to schedule patients, where they have to bill, they have to do all this stuff. None of that's necessary. Patient comes in and needs something, you simply hand them a cell phone or an iPad, and they link to me, I take care of it. So this injury, chiropractic med injury program is very effective at treating patients and growing your practice. It's free, you got nothing to lose by looking at it. So give me a call when you get a moment, 866-402-4250. Now, secondly, we have a program that goes beyond injury care. Some of my chiropractic colleagues do not accept car accidents, but they do want to integrate chiro med services in a fully integrated program. So they again can go out and market to their local physicians and patients that they have a medical doctor on staff. So watch that video. That video is on our website, Florida Injury Medical Centers, under the tab Who We Work With, under that tab Chiropractic Physicians. And you'll find out how we can provide that service. Again, free, nothing to buy, nothing to download, no out-of-pocket cost to you. So give me a call if you'd like to chat, 866-402-4250. Thank you.